I think AI is a powerful tool that is very much dependent on the data that is fed into it and also the intent that it is designed to achieve.
Okay, welcome everybody back to the Brainiac Blueprint. Today's episode is a part of our healthcare series. I'm excited to introduce to everybody Oghosa Evbuomwan. How are you, Oghosa?
I'm good. Thanks for having me, Kyle.
I've been practicing your name all day. Did I say it correctly?
That works.
Awesome. Well, I know we were talking earlier. I'll be calling you OG since we're friends now, but OG is the head of marketing at Agilix Health. You can check them out at agilixhealth.com. That's AGILIX health.com. How's your day going, OG? Can you tell us a little bit about your experience and kind of what you do there?
Yeah, sure. Thanks so much for having me again, Kyle. Day is going okay. St. Louis, we had serious, crazy heat advisory the past couple of weeks, but now it's sort of getting back to normal. So a quick introduction of myself. I'm Oghosa, originally from Nigeria. I'm the head of marketing at Agilix, and my background spans medicine, public health, and business. With experience in clinical care, where I practiced as a primary care physician for over 7 years. I was also involved in health tech, strategy, consulting, and so on. Currently at Agilix, managing the marketing department or division. I'm very focused on translating complex health programs, health systems into something that is more practical and applicable to patients, something that's more patient-centered and very digestible in the current health context.
Amazing. And tell everybody just a little bit about Agilix and what you guys are trying to accomplish, who your target audience is, all that good stuff to kind of set the stage here.
Yeah, sure. So Agilix is a digital health company. We're based in Massachusetts. What we do is provide whole person nutrition care to people living with chronic conditions and pregnancy. So people managing cardiovascular conditions, different types of cancers. So what we do is provide that longitudinal care such that when they're outside of the hospital setting, where health actually does happen at home, right? We help ensure that they are optimally, they have their nutrition optimized so that the treatment they get in the hospital yields the most benefit at home.
I'm a firm believer that our lives and our health are built in the kitchen more than anywhere else. When you're putting the good fuel in you, you feel great. If you're putting the bad stuff, you're sluggish. So
absolutely,
that's great stuff. Cool. So before we jump into everything, I know I told you I love to get everybody's kind of quick response to this prompt. So if you could let us know, I think AI is.
I think AI is a powerful tool that is very much dependent on the data that is fed into it and also the intent that it is designed to achieve. For instance, healthcare AI is very much different from, say, a defense AI, right, or climate AI. So what kind of data are we feeding into it to build the algorithms that it runs on, and what kind of intent is it designed to achieve?
I think that is such an important point that people don't necessarily think about or overlook. The instructions, the training, and it's just like humans too. If you're trained on incorrect information, you're going to operate incorrectly, right? So
Exactly.
You need to have the right information, the right data for it to operate, give you the right output and all that kind of stuff. So that's great. I think that's perfect. I think it's going to set us up nicely for a great conversation here. Before we jump in, there was two quick things that I wanted to follow up with you about. I was taking a look at your LinkedIn and I saw you had an interesting post about Grok 3 and it being a little deceptive. And I think this kind of was a good segue from your initial concept there. Can you tell everybody about that?
Yeah, it was interesting because I'd asked it to confirm an information for me, and then it gave me an obviously generated response by it. And then I asked, is this content AI generated? And then it said, no, it wasn't AI generated. It was crafted by it. So that sort of gave us some insight into what ethical AI should be, or ethical systems being built into AI. Right? We have, especially in healthcare, which is heavily regulated, if we don't have systems that hold these systems accountable or the vendors behind them accountable, it's sort of tricky deploying them at scale.
Right. Exactly. That's perfect. I was honestly, I was reading through and it made me start to laugh to be like, no, this isn't AI generated. I'm not AI. Yeah,
Hmm.
that was so interesting. Cool. The other thing I wanted to ask you about is I saw that you were recently at a summit in Webster University. I was just curious how that went and kind of what the goal was there.
Yeah, sure. The goal was really to speak to African diaspora, how are we tackling preventive medicine, because many people, especially from the continent, come with different biases. So how are we integrating into the kind of health systems we have here, the public health infrastructure, the clinical med, because I mean, a couple of um the panelists were are practicing physicians, right? So we
Hmm.
came to address some of the biases that people have with regard to, say, their health-seeking behavior or how they interpret certain symptoms, right? So how do we make sure that when we have these symptoms as African diasporans, what are the right resources to deploy, right? Where are the right places to go? What kind of outlook should we have towards healthcare?
Amazing, amazing.
Yeah.
Do you still find events like that to be helpful? I know they're kind of hit or miss. I feel like you either love them or hate them. So I'm kind of curious as to how you approach events like that.
Yeah, sure. I mean, it totally depends on the mindset one has, right? If you're open to learning and networking and just growing your network, it is an exciting place to go. And in terms of getting to know what is out there, because these are people that are at, the cutting edge of healthcare. I was very privileged, excuse me, to learn from, say, the breast cancer, so the breast surgeon,
Hmm.
the sleep physician, there was a neurologist on that panel, just to get a sense of where things are and where things are going in the future. I also shared some updates on a recent paper that was published on Lancet Medicine, where we don't need up to 10,000 steps. That was a myth. It's a myth that was popular for a very long time. We just
Hmm.
need about 7,000 steps per day. In fact, from 3,000 steps, you start seeing the health benefits. So those kind of information came at scale during that program. And similar programs have those kind of info, share those kind of information.
Well, as a work from home sedentary guy, I like that. Let's lower the bar. It's easier for me to accomplish. Those
Exactly.
7,000 steps are great. That's awesome.
Mhm.
All right, let's jump into the meat and potatoes here. Jump into some of the different topics that you and I were discussing earlier. So I wanted to jump into advanced primary care and the adoption of tech in clinical practice. I know this hits at home for you. So, what does advanced primary care mean to you, and how can they adopt tech to kind of accomplish their goal and provide better care?
Yeah, sure. Advanced primary care goes beyond just the episodic visits that people make to their providers, let's say to check, to do their annual physicals and stuff like that. It goes beyond that to integrating that longitudinal piece where there's some elements of remote patient monitoring, automated scheduling, there's some predictive analytics. Let's say you wear some smartwatch or, your continuous glucose monitors, as the case may be. So you
Hmm.
revise all those data in the clinic with your physician to help guide your health goals, right? If you go for, let's say, primary care visits as in an annual physical, right? The benchmarks are made, let's say your blood pressure, your cholesterol level, and stuff like that. Now, when you come in the next time, we check how has it been, from your last visit, right? What advanced primary care does is to make sure that between those visits, there's some trailing. We track what the number of steps are, what the glucose trend has been, what the sleep hours has been, and stuff like that. It sort of
Hmm.
embeds technology into regular or traditional primary care.
I find that with a lot of, for lack of a better word, things like that there's additional steps that you need to do. There's almost a mental block, and that it feels like work. It's extra things that you have to do and think about and stuff like that. So I'm curious how you approach that. Whether it's like, obviously there's tools and things like that, but how do you think about the mindset of getting to be like, you have to do this to take care of your health?
I think a lot has to do with how the provider, speaks to the topic with the patient,
Sure.
because digital literacy, health literacy are big factors when it comes to adoption of some of these practices. So how well a provider is able to convince a patient to use some of these tools or follow some of the prescriptions that are made during those advanced primary care consultation visits, that would go a long way in determining how successful the program is.
Great. Yeah, that makes total sense. I'm curious. Obviously, you can't go into specifics like names and stuff like that, but I'm curious if you have maybe a win that you've had in your career that you're really proud of that you might be able to share with us. Anything? Again, I know you can't give like names and everything, but I'm curious if you have anything like that.
Yeah, sure. I mean, there have been various inflection points in my career, especially when I launched my health tech startup back in 2016. We recorded huge, success there. And also working with some startups in Switzerland, and they're doing so well right now. There's a specific one that back in 2022, they were, in fact, I think they started a few years before 2022, but I was brought in to help build a marketing plan for them, and they went on to, spread across Europe, and now they're even considering coming to the US. So they are doing so well. I'm grateful that I was part of that story. And now at Agilix, we are doing so well, in terms of our patient growth, the partners that we're onboarding every week. These are some of the really exciting inflection points for me.
That's awesome to hear. I love that. Love hearing some wins. So I'm curious, without giving away your complete secret sauce, what has been your strategy, your winning formula here for patient acquisition and retention? I think that's something that gets overlooked a lot. But is there a specific channel? Is there kind of messaging strategies? What how have you kind of built this up so that you have some of these wins now?
I think personalized care is a big deal, especially in the US where there's so many moving parts in the healthcare system. How well one is able to personalize care for a patient and, make it as accessible to the person as possible. For instance, part of our campaigns is now having to translate the languages so people understand what we are trying to communicate to them in their local dialect. That is one. And again, going back to that digital literacy piece, right? How well are people understanding how to use technology? Because we're a digital health startup. Part of our core business model is to send a cellular scale to these patients. How do they understand the use of this scale? How easy it is for them to use in their day-to-day daily living. So I see dumbing down some of this information as something that is useful in helping us succeed and just being able to personalize our approach.
That's perfect. So I want to jump into personalization, but before I do, I'm curious, do you guys have people on staff that are translating or are using AI to do that?
Oh yeah, so we're not using AI at this level at this time for this. We have people, partners that are helping us with some of these tasks.
Interesting. Okay. Still there. That's I like to hear that. I think there's some authenticity to it. So
Yeah,
that's
and
great.
and and there's something very important with AI, right? Especially in healthcare. If you remove the human in the loop, it just becomes, every other type of AI. We know that healthcare is a very niche space, highly regulated, and deals with lives, right? So
Yeah.
without the human in the loop, it becomes really it becomes tricky. You
Mhm.
always need a human element to vet whatever the AI is spitting out, or how you are integrate. When you integrate AI, it has to be part of the human cycle, as opposed to the opposite, where you have AI and then you're just putting the human as an arbiter of some sort. If that
Mhm.
makes sense.
Yes. Yeah. Absolutely. Absolutely. It's always interesting to see how people use it or don't use it. So.
Exactly.
So I do want to jump into personalization. I think that is just obviously such an important piece of marketing today, and especially in healthcare, or especially anything where you're making a decision that isn't just like, oh, I'm going on Amazon to buy shoes. There's a lot that needs to be specific to you. There's always complications. Obviously, HIPAA is a thing that we need to keep in the back of our minds as healthcare marketers. So I'm curious how you balance patient privacy with AI and personalization and things like that. I was not to go off on a tangent, but I was just reading an article about people saying, if you're going to group people and refer to them, you can't say, oh, you are a diabetic, but it was like, I know you consumed my diabetes info, like that kind of stuff. Like the wording there is interesting. So I'm curious how you approach it and how you're always making sure HIPAA is, satisfied with your personalization and your marketing.
Yeah, sure. Privacy is at the core of what we do. We make sure that, whatever information we are sharing, say with third parties, you know, um, is de-identified, as much as possible. And like I
Hmm.
said, we're not deploying AI at scale at the moment, but we do prioritize privacy in our interaction with third party
Sure.
vendors, right? And when it comes to the other stuff you talked about, right? Making sure that we are protecting the client information, um, this is something that we regularly remind ourselves. We have several training sessions, especially for the staff members, to make sure that whatever information that is being circulated, even amongst ourselves, does not contain, patient personally identifiable information,
Yeah.
right?
Yeah.
Yeah, and of course, our tech is also designed in such a way that patient information cannot easily be sent across, say via email and stuff like that through
Sure.
external bodies. Yeah.
That makes 100% sense. So I'm curious, diving just a little bit deeper into personalization, how are you guys approaching it in terms of, are you thinking about it by, condition? Are you thinking about it about cultural differences? Maybe it's like urban versus rural, all of the above. I mean, there's so many ways to slice and dice it. So I'm curious what, your winning formula is, or kind of like what you're testing out to try to see what's working best.
All the above, right? So, like I earlier said, right, we're looking at translating some of our, medical campaigns and even consultations, right? Because the core for what we do is to put the registered dietitian, at the home of our patients, right? Or we call them members, right?
Yep.
And when we do that, we make sure that the language being used in every interaction is culturally sensitive, and we're sure that um, the consultation, or let's say the recommendations by the dietitians, are very sensitive to the nuances of what this person wants. For instance, the kind of foods that they are used to, right? Is it healthy? We want to make sure that it is aligned with um, what the doctor has prescribed and what the person is culturally sensitive to, right?
Hmm.
And this also pairs to the care pathway, right? Is this a menopause patient? Is this a um, breast cancer patient? Is this a chronic heart? It depends on the care pathway that we're dealing with. We try to tailor the recommendation to that specific care pathway as well as the cultural sensitivity of the individual.
There's so many things to consider. It really is just crazy. All the angles and things that you need, the boxes that need to be checked off, if you will. And I think that goes hand in hand with a huge point that you made earlier of the fluency and the literacy and the tech savviness of the people that are providing it as well, and making sure that there is a certain level of training that is happening. So I'm curious if you've been involved in this kind of training. What have you gone through, and are you even on the other end of helping to train other people? I'm curious what that all looks like from your experience.
I mean, I've been on both sides of the aisle, just learning how this is done because this space is a highly evolving space, right? So you have to always be learning in order to stay ahead of the curve, right? And also, having learned a lot on this journey, it's also incumbent on you as a leader in the organization and even in the
Hmm.
industry to give back, especially to those that are up and coming. Let's put it that way, right? So they get the benefit of what you've learned, and you also stay on track, learn these things. For instance, on my team, there are a couple of interns that I, not just telling them, okay, these are some of the things that you need to do in terms of brushing up on AI literacy or fluency, but I
Hmm.
also make sure that I take some of these courses to be sure that they meet the criteria that I want them to attain as interns.
to our point earlier, if you're giving them courses that are giving them the wrong information, then
Exactly.
it's just the wrong stuff. So
Mhm.
I'm curious if you think that there something that medical curriculum is doing well right now in terms of keeping people up to date, and if where are they missing the boat?
Yeah, so there's a gap in digital literacy in medical curricula. I mean, back in 22 or so, we published a paper on this specific subject, and we found that majority of medical trainees are not, digitally literate, if that makes sense, right?
Sure.
They're not fluent, they don't understand um, health talk or health speak or health tech
Mhm.
speak, right? Um, what we've sort of been advocating for is to make sure that we embed that ICT, information and communication technology training into CME courses, such that as a provider, especially, if you've gone through the medical training, right, you're already certified in, treating patients, identifying, making diagnosis and treating. But then we're in a world where you need to be digitally savvy, right? So with
Sure.
these ICT inclined CME courses as part of your, as part of courses you have to take to be accredited, let's put it that way, you're making yourself more attuned to what the times require. What I mean by that is you are not just able to make diagnose and treat, but you're also able to use digital technologies to diagnose and treat your patients.
Sure. Sure. That makes 100% sense. Yeah. I'm curious, you are a highly trained, highly educated individual through, your experience and obviously going through med school and everything like that. AI is obviously a brand new thing. And again, there's always new information kind of coming up. So, what is your process for like, as you consume something or as you try something to determine, okay, this is something that I want to continue to pursue, or no, like this seems like a little bit of BS and I just want to kind of like throw this to the side. Like, do you have kind of a process for identifying that?
Yeah, so I mean, I don't necessarily have like a template or a heuristic on,
Sure.
handling this kind of stuff, but I think my regular go-to strategy is to know who is behind this paper. For instance, when I go through papers on, these trending technologies, who are those behind it? Who are the authors? What are the affiliations? Who funded this research? Who funded this technology? Because that sort of gives a window into the motives behind the technology, right? You want to understand what is driving this technology, right? Are they trying to steal data? Are they trying to, drive a specific agenda? That sort of guides me in how I interpret even the output if it's something that generates outputs.
That's a great point. I think, whether it's subconscious or not, everybody has some kind of message that they're pushing,
Hmm.
right or wrong. And
Hmm.
again, there doesn't necessarily need to be something, malicious behind it or something like that.
Hmm.
But again, we all have biases. We all don't necessarily realize that we're in some way on autopilot and things like that. So it's
Hmm.
great to kind of, do that research and understand who is saying what and why. So.
Exactly.
Awesome. So let's jump a little bit more into tech and thinking about tech in the hand of the end users, and being able to access tech, kind of based on their condition and their use case. And this was something that you and I have exchanged back and forth about a little bit. So what is something, or it could be multiple things that you think every healthcare provider should at least be considering to include in their practice to be giving to their patients?
Yeah, I think being aware of the edge cases that, that could break this AI or the technology that you want to adopt is important because algorithms follow a protocol, right? One plus one is two, two plus two is four, right?
Sure.
You want to make sure that whatever one is adopting into a health system or, healthcare practice accounts for those edge cases that are not necessarily baked into the algorithm.
Got it. Got it. And I'm wondering again, thinking about just like tech for the end person, is there a tool? Is there a platform? Anything like that that you think all patients should have this?
Hmm. I think it depends, right? Because the word patient is not a monolith, right? There are people that are
Sure.
managing, PCOS, managing, uh, different types of conditions, right? And I would defer to what the provider recommends. I wouldn't want to just give a blanket recommendation.
Fair enough. Fair enough. Do you have something that you always, if possible, try to recommend or anything like that? Do you have a specific tool or anything?
Not necessarily.
No.
Not
All right.
necessarily. I mean,
Nice. Yeah.
I wouldn't want to like push any form of tool or.
Well, I
Yeah, I
mean, to
mean,
our conversation earlier, things
mhm,
need to be personalized, right? So yeah, you're not just going to recommend, a tool or a piece of
exactly,
tech. Exactly. Yeah.
exactly.
Cool.
Whatever resonates the most with you is what, yeah, you should
100%.
go for. Mhm.
Cool. So I'm curious how you view the future of healthcare and health tech and AI. Do you have any kind of predictions? Do you think there's anything that's going to fall off and stop happening, or do you think there's anything that's going to come up or accelerate? Or I'm curious. And the reason I bring it up is actually, you know what? I have an answer that a previous guest gave me, and I'll tell you afterwards because I don't want to influence your answer. So I'm curious if you think there's any trends that are going to stop or start or anything.
Yeah, I think the current system or the way we deliver healthcare is very old fashioned, is very, you know, g- general. I think in the future, we're going to have a lot of hyper personalization of care. We're going to see a lot of the advanced primary care stuff we talked about earlier, where people are going to rely heavily on predictive analytics, remote patient monitoring, like what we're doing, right? And it's going to be a lot of prevention rather than therapeutic, right? You don't want to wait till someone has developed complications or has a diagnosis before you try to treat, right? You want
Yeah.
to meet patients where they are, like what we're doing, right? Even if we are turning to people that are already diagnosed, but in the future, it's going to be how do I stay healthy, right? The health part of healthcare has to be priority.
And that's why I didn't want to go first because I thought you were going to say something similar. So a previous guest had mentioned that he views kind of eventually going to or aspires to doctor visits to be going to help you thrive as opposed to just fixing something.
Mhm.
Kind of like not only just preventative care, but structuring your life and moving forward and getting like incremental changes to get better and better as well. And I feel like that aligns. I don't want to put words in your mouth, but I feel like it aligns kind of with the your motif here of just
Yeah, yeah.
prioritizing health and everything. Yeah.
Absolutely. And the way I see it right now, it's you have to go to the hospital to see a doctor who sees other patients. Most likely we're going to see instances where doctors can have like a digital twin, right? Who is very much attuned with your health data and would give you hyper uh personalized prescriptions or recommendations.
Yeah, 100%. I'm curious, whether this is what Agilix does, or if you just have a personal kind of philosophy on this. I think one of the largest frustrations that individuals have when it comes to healthcare is billing. Just is my insurance accepted? Is Medicare
Mhm.
accepted? What is my copay? All of that kind of
Mhm.
stuff. And I think as marketers, we need to be empathetic and compassionate to that and make sure that we're answering those questions up front as clearly as possible. So I'm just curious as to how you approach that, so that people aren't scared and they will do these, preventative measures and will try to, get to the doctor not only when it's just something bad, but to try to, get better and better.
Yeah, so the good thing is most of these preventive measures are covered, by insurance companies. They have CPT codes, for instance, for remote patient monitoring. What we do at Agilix, we have a team of people that are tasked with, verification of benefits. So once a patient is referred to our program, these guys go through verification of benefits, before we reach out to them. And interestingly, more than 90% of instances, right, patients are covered by let me say this, more than 90% of instances, patients have the insurances cover our program, right?
Right.
So many of these predictive analytics stuff, remote patient monitoring and this trendy stuff, right? Insurance companies are sort of covering or catching up with the trend. And this makes sense because insurance companies are incentivized to keep you out of the hospital as much as possible. And if these
Mm.
technologies can demonstrate value, this is where value-based care comes in, then uh, they would cover it, right? If they have to pay, whatever AI startup or value-based care
Yeah.
enabler to make sure that you don't visit the urgent care or, the ED, then they'll do it. And thankfully, they cover that for the most part.
It makes sense to your point that they would. It's almost like the same concept of, you get charged less or more whether or not you smoke, or like, are you
Hmm.
active and going to the gym and things like that. So it makes sense. Are you a part of the conversations with the insurance companies? And I'm curious, my cat just came to say hi. I'm curious as to what those conversations are like. If there is just kind of a lot of, back and forth trying to figure out the right way to handle it, or they're just like, this makes sense. Let's figure out a way to make it work.
Well, I mean, at the moment, I'm not involved in those kind of conversations, but thankfully, we have a team of folks that, are more equipped to have these conversations than I have.
Awesome. That makes sense. Cool. So, Oghosa, I've gotten through most of what I want to discuss through with you. I do have some rapid fire questions. So I'm gonna throw them at you right now, if you don't mind. So, if you had unlimited funding for one Moonshot AI health project,
Mhm.
no red tape, just snap your fingers, you got whatever you want. What would that be?
I think it'll be something along the lines of predictive analytics. I want to
Okay.
know, like right now we have weather forecasts, right? They can tell us what the temperature is going to be tomorrow. Is it going to rain? Is there going to be a storm? We don't have that for the most part in healthcare, or it's limited in application. Right? If we can have something that is hyper, that has a high fidelity in terms of predicting what's going to happen with my health in 2 days' time, in 2 months' time, in 2 years' time, that would be great.
So do you think that wearables are going to become more and more popular and more advanced, and just different ways of using them and things like that, so that you can have those kind of predictive analytics and data
I,
points?
I think so. I think they're gonna shift from being wellness devices to medical devices and vice versa, right? They're gonna shift from medical devices to wellness devices just so they can scale through the FDA regulation.
Yeah. I can't remember if it was Google. I was just reading an article about, I think they're patenting like skin,
Mm.
kind of like wearable tech skin, and it's just crazy to think
I'm
about.
not
But
I'm not surprised.
yeah, yeah. I mean, Elon with Neuralink already has that. So
Hmm.
it's, we're getting there. It's insane to
Exactly.
think about. Cool. What is one buzzword in health tech you wish people would stop using?
Hmm. That's a good one. I haven't really
How
thought about it. Um,
about one that you like, if that's easier?
um, I wish we could do away with the word maybe patient,
Okay.
Yeah, because at the end of the day, they're actually, if we see them, if we see people, I'm sure at some point you've been to the hospital, right? Um, it might be triggering to a few folks when they are called patients, right? You should call them by their names because they're actually users or members of your program, right? When you say
Yep.
patient, it sort of limits their rights, and yeah, it might be demeaning to some folks.
You're speaking like a true marketer right now. I think, the psychology of it is coming in. I have so
Mhm.
many instances like that. Like, I try not to refer to my partners as clients. I refer to them as partners. Or as
Hmm.
a paid media guy, I try not to be, ad spend. It's ad investment, because you're trying to get something
Exactly,
back,
those kind
right?
of
So,
stuff. Exactly.
there's kind of like little tweaks like that can have an impact.
Mhm. Yeah, just in fact, there's say someone is diabetic, right? Say, people with diabetes, right? Or
Right.
someone with say someone is hypertensive, say people with those kind of little tweaks.
Yeah, I love that. I love that. What is one tool currently right now, just that you use in your day to day, that you can't live without?
Hmm. I'll say ChatGPT.
Okay, I like that. ChatGPT has done such a good job of just integrating itself into everybody's life so quickly.
Yeah, yeah, especially the agentic mode, right? As I'm having this conversation with you, I have agents doing different stuff on my behalf, right? So,
Absolutely. Absolutely. Love that. If you were to write an autobiography, what would it be called?
Hmm. Interesting. Um,
I'm coming with the hard-hitting questions now.
yeah, that's a tough one. I mean, I'm just thinking about yeah. I think I'll call it my vision, right?
My
Because
vision.
my vision, yeah,
Okay.
because I would see it as something that I would struct it'll be structured along the lines of um many of the things I'm doing now, I've always had the vision to do them, you know, and how I see the future panning out is very much aligned with what I've always, um, thought it to be like, if that makes sense. For the
Sure.
most part, not, I mean, you don't get it 100% of the time, but it's just, you know, vision for healthcare, vision for health tech and stuff like that.
I like
I would,
that. I
I'll,
like
I
that.
like to put all those into a book.
Perfect. I like that. I like that. And last rapid fire question: if you weren't in healthcare, what would you be doing?
Hmm. I'll be doing marketing.
Okay, fair enough.
Yeah.
Fair
Because
enough.
right now I'm doing marketing in healthcare, so I guess I'll be doing like pure marketing.
There we go. There we go. I like that. Awesome. Well, that was pretty much everything that I wanted to run through. So I wanted to jump into the open forum section here, OG. Is there anything that you are super passionate about that maybe we didn't get to that you want to discuss or make sure our audience gets to hear about?
Yeah, I think the concept of preventive medicine is not talked about as much as we should. I think more people need to know that they don't need to have symptoms before they present in the clinic or at the hospital. You need to check your blood pressure, you need to know what your sugar level is like, your cholesterol level. Yeah, many people understandably are underinsured or uninsured, but the more we are intentional about our health, the more we sort of prevent those catastrophes that come with when we delay some of these things.
As a man, we get a bad rap for not going to the
Hmm.
doctor when we need it. So that certainly resonates. I'm curious if there's any other groups or demographics that you see are slower to act or even quicker to act. Like I'm sure moms,
Hmm.
are super quick to jump in, but I'm curious if there's any other kind of demographics that you think could do better or are, doing great, who we should strive to be.
Yeah, I mean, and that goes back to the program I talked to you earlier on about, right? The immigrants are less likely to present at the clinic, or
Sure.
seek health. They have poor health seeking behavior. So, yeah, that demographic definitely needs to ramp up on how
Do,
they do preventive medicine.
do you think that's a cultural thing? Do you think it's a financial thing?
I
A
think it's all of
combination?
the above,
Oh, sure.
information, cultural, and how we interpret illness in general, right? There's a spiritual connotation to some of these things. We need to see science for what it is, see health for what it is, and when we have, even before we have these symptoms, before we have these complaints, we need to um, yeah, be more proactive with our health, uh, yeah, health behavior.
Just out of curiosity, are you by any chance still involved with, people back in Nigeria, whether it's family or healthcare related or patients? I'm curious what your relationship is still there.
Yeah, sure. I mean, I'm still very much in talks with my family,
Sure.
generally, and of course my friends, right? People who went to medical school together, and those that are in the health tech space. We have a Digital Health Nigeria, WhatsApp group, where people are
Oh,
constantly
cool.
doing stuff across Africa. I'm always happy to read some of the strides that we're making.
Amazing. Very cool to hear. Very cool to hear. So, awesome. OG, this has been great. I really appreciate your time jumping on, sharing your expertise and your insights. Again, everybody, you can check him out at Agilix Health. He's on LinkedIn. Do you have any other kind of sites or social medias that you want to share or plug or anything like that?
Not really, just I'm just on LinkedIn. That's my primary social media
Awesome.
platform.
Awesome. So again, you can find him on LinkedIn at Oghosa Evbuomwan. That will
Mhm.
be in the transcripts and everything, so everybody will be able to see it. But OG, thank you so much for joining me on the Brainiac Blueprint. This has been great. Again, I appreciate you sharing all of your insights. If you don't mind, take a look at the camera and just say, stay brilliant, Brainiacs.
They're brilliant Brainiacs.
Awesome. Thank you.